Community Hospital South is a green building. It's designed to be friendly for the environment. What we've done is incorporated many building materials, renewable products, sustainable products, products that are used not only to reduce the impact to the environment during manufacturing process, but also during its whole life cycle of the product.
My role in the project was to take on the challenge from a system engineering standpoint of making sure that we created the most sustainable engineering systems in the hospital that we could, and those systems involved the heating and cooling of the hospital, lighting, the electrical systems, the plumbing systems. A key method that we used was using a computer model that would allow us to simulate the energy consumption of the facility using different materials, different products, different equipment, so that we could go through a higher level of scrutiny in selecting and providing the best efficient selection of systems that we could for the hospital. We're looking at intelligent systems and efficient systems. When we looked at intelligent, we wanted them to be able to respond to the usage of the hospital, and if it wasn't needed, they could turn down. We also looked at various ways to recover byproducts of processes that we have to do to produce cooling and heating within the hospital. One of those byproducts is water that's created off of doing the cooling process, where we send that water back to the central plant to reuse it instead of using additional water from the city. One of the important aspects in energy conservation in a healthcare facility is lighting. It's a very high consumer of energy in a healthcare facility, and one of the leading edge technologies that we are able to incorporate into this hospital is LED lighting. It's a 20% more efficient lighting source than fluorescent lighting, and a 60 to 70% more efficient lighting source than traditional incandescent lighting.
My role on the new project at Community Hospital South was as the lead interior designer on the project. I was responsible for selecting all the interior finishes, working with the project architect on laying out the spaces and coordinating the different functions. Some of the key areas that we wanted to focus on to make the building more environmentally friendly were specifically the finishes, dealing with the thermal comfort for the client and the users and the patient, and then also just the lighting control and the daylighting and views. All of the materials that are incorporated in the project lead to the overall healing environment. In this project specifically, we have incorporated a lot of low-emitting materials which help lead to a better air quality. An example of some of the materials that are specified in this building that are environmentally friendly, rapidly renewable, or sustainable. Starting with the floors, the vinyl composition tile that you see throughout all of the corridors has a high recycled content in it. The wall protection, which you also see in the corridors, is PVC free. The ceiling tiles have a high level of recycled content, as well as the steel ceiling grid. And eventually the resin panels that will be going at the head wall are also a rapidly renewable resource and PVC free. We also specified recycled content in a lot of the upholsteries that you'll see on the furniture, and then also specified FSC certified wood, which is an environmentally sustainable timbering process for all of the wood on the project.
I think it's wonderful the community is pushing the envelope and that we can be a part of trying to find different ways to deliver a very wonderful facility, but at the end of the day consume less energy and provide a more sustainable environment.
The whole purpose of healthcare is to treat people, make them better, to serve the community. So one part of that is to actually have a building here in the community that's healthy for people to come into and to receive their care. As much as the physicians and the nurses are trying to treat the patients, we also need to give them an environment which will allow that healing to take place.